Evening, everybody. We're back with another live roundup of the Alberta Politics things. And we've got ourselves a little bit of a show. Today is April 14th. I'm your host, Nate Pike. This is the breakdown. I think I've covered it all, but I do have to cover off one other little thing because it's a couple of the topics that we're going to be talking about. We're starting right out of the gates with sort of a first responder theme. A healthcare first responders theme. So, just to be super clear, any views that I express in tonight's podcast are purely my own and not in any way to be interpreted as the views of any organizations or employers that I may or may not be affiliated with. Because the very first thing that we're going to talk about tonight is it's an EMS thing. There is a new deal that was announced. And it's, new. We've been getting DMs about it for quite some time. There's been a lot of anecdotal reporting that's been going on about it for the last little bit. Gotta fix my chair. But it turns out that the much promised ballyhooed delivery of EMS transfers has been privatized. It's been contracted out. Call it what you will. Now, there's a couple of different pieces in regards to in this whole thing. But before we get into the commentary part, let's let Health Minister LaGrange address it.
That Alberta Health Services has awarded contracts to two partners to provide scheduled, low acuity interfacility transfer services. These contracts in Calgary and Edmonton will provide non-urgent transfer services, bolstering the resources of our EMS system. So this strategic initiative will enable Alberta Health Services to help ensure that ambulances and paramedics are available to respond to emergency medical calls in Calgary and Edmonton and the surrounding areas.
There we go. So that on its face doesn't sound terrible. There's going to be transfers that are going to be done by these private companies. But who are the private companies, and how many ambulances are we talking about being moved into or moved out of, depending on how you choose to look at it, the system?
Partners for non-urgent low acuity scheduled transfers. 45 new resources are being added to the emergency medical services system. 26 of these resources will be in Edmonton and 19 in Calgary. They will be phased in starting in June and July until they're fully in place, which is expected later this calendar year. By focusing these resources on non-urgent interfacility transfers, we can direct our current EMS teams to improve EMS availability for 911 response, help keep ambulances in their home community, and allow paramedics to finish their shifts with reduced overtime. These additional interfacility transfer resources will help ensure that non-urgent patients that require transport for treatment or diagnostics will arrive on time for scheduled appointments, which supports their own individual care plan.
So let's break down what they're talking about there, because we got a couple of responses from a couple of folks that we're gonna try to bring in just a second here as well. But to start with, what we're talking about is there's two private companies that have been announced. This is Guardian Ambulance, which is a subsidiary of another company that we've talked about on the show before, in Calgary, and Associated Ambulance in Edmonton. Edmonton's going to get 26 of these private transfer ambulances. Calgary is going to be getting 19 of these private transfer ambulances. Now, what does that mean? Well, in the land of EMS, there's historically, there's been two separate divisions, if you will. You call 911 because you were messing around with the table saw and you cut your leg off. And so an ambulance comes, they do what they need to do, and they take you to the hospital. There's also been a separate branch of EMS called interfacility transfer. And that's when there's somebody who's inside of a hospital who requires medical care or observation because of the nature of the thing that they're in the hospital for, but they have to go to another facility for a test. So you can imagine if there's somebody who is in, let's say, here in Calgary, in the Rocky View Hospital, for example, and they've been admitted to the Rocky View Hospital. They've got a bed in the Rocky View Hospital, but they're there because they had some chest pain stuffs, and their blood work shows that maybe they've got some cardiac stuffs going on, so they need to go to the foothills for a higher level of investigation. It's not a big rush. They're stable. Everything's good, but they should get there. A transfer is booked. An ambulance then shows up, picks up the person, takes him to the foothills. They do their appointment. Another ambulance picks him up at the foothills, takes him back to the Rocky View. And there's a lot of movement that happens in the system like that. For example, another easy example, let's say that somebody goes to an emergency room, but there's no beds available in that hospital. That hospital, if the patient is stable, would then book a transfer, and that person would then get taken to the hospital that does have some beds available. So there's a lot of moving pieces inside of the healthcare system, and historically, EMS has been a big part of moving those people around with their interfacility transfer division. So what's happening here? Well, they're pretty much getting rid of the interfacility transfer division and farming it out to two private companies, at least in the areas of Calgary and Edmonton. Now, there's some interfacility transfer resources that are going to be held on to, but these two private companies are going to be taking over the lion's share of all of those sorts of transfers that I just described. Now, you may be asking, well, what's the problem? And the answer may well be there is no big problem. But there are some questions that need to be asked. One of the questions that could very easily be asked is if the province is willing to dump however much money into these contracts. I mean, we're talking about 45 new resources, 26 in Edmonton, 19 in Calgary. If the province is willing to dump the money to get those contracts and those ambulances up and running into private companies, couldn't they have just dumped that same money into the existing resources? And the answer to that question is probably yes, they could have done that if they wanted to. Now, another important thing to understand about the interfacility transfer piece versus the emergency piece is very much like a physician is not a physician is not a physician. A gastroenterologist has a very different area of specialty than an oncologist or a cardiologist. They're all physicians, yes, but they have specialized in different sandboxes inside of medicine. There's a very strong argument that's been advanced through a couple of news reports that interfacility transfer paramedics are a different specialty than emergency paramedics. So you have to ask the question, if all of these new resources are being added to the street, what's happening to those interfacility transfer paramedics who have worked in the interfacility transfer specialty for quite some time? Well, apparently, most of them are going to be absorbed into the emergency side. Now, I want to be clear. Paramedics are known for being, let's go with, adaptable. And there's no doubt that given enough time, most of those paramedics will have no problems adjusting to the emergency side of EMS. But the reality is there are some paramedics who chose to go to the interfacility transfer side for a lot of different reasons. Some of them might have been quality of life, some of them might have been physical, and some of them might have been related to mental health. And forcing all of those people to either go back to or go into the emerge side could have unintended consequences. And there was nothing in the announcement that came from the province that addressed how those people are going to be taken care of. And again, the fundamental question remains, if the province has the money to generate these new 45 resources, why didn't they just generate these new 45 resources inside of the existing system instead of profitizing it out? I think I might have answered the question right there. Understandably, the response has been not great from a lot of the subject matter experts that exist out there. HSAA, or the Health Sciences Association of Alberta, which is the the union that represents paramedics in the province of Alberta, they had some very real concerns, and they issued a statement saying as much. The statement goes, the government has announced that the Guardian Ambulance, a division of Medivie Health Services West, will take over IFT in Calgary, and Associated Ambulance and Services will take over IFT in Edmonton. The tragic lessons Albertans learned from the failure of Dynalife Labs was that the promise of cost savings and improved efficiencies from corporate healthcare are nothing but a sham to undermine the public healthcare system, continued Parker. For-profit healthcare reduces the quality and availability of healthcare as corners are cut in the market in the name of profit, leaving Albertans to pay the price with their health. The government claims this will help provide more resources to EMS, but evidence indicates that it will only worsen the healthcare staffing crisis. A report from the New Brunswick Auditor General and another from the National Union of Public and General Employees found severe issues with the quality of care and fiscal management when Medivie took control of EMS in New Brunswick. The Auditor General of New Brunswick's 2020 report reveals the detrimental effects of for-profit EMS delivery. It led to a paramedic shortage and resulted in Medivie receiving $8 million more in revenue than it should have. The contract with Medivie allowed excessive use of staffing exemptions, leading to overstatement of response time performance. So, there's a lot of questions. There's a lot of concerns. It will absolutely be fascinating to see how it all plays out. Moving on from there, we're going to go from paramedics to police, because one of the big announcements that the province tried to make this week had to do with policing services in the town of Coaldale. And this is a weird one. It's kind of some might consider it a cautionary tale, if you will, in flirting with a private police force. May or may not be relevant to any discussions going on in the province currently. So, here's the background. In 1992, there was a decision made that if you moved away from the RCMP providing policing services in any areas, then if you tried to get the RCMP back, that would come at your dime. Historically, when the RCMP are contracted to any municipal area or provincial area, there's a certain degree of savings that are provided, a certain degree that the federal government kicks in. It can range anywhere from 10 to 30% for cost savings if you sign up with the RCMP. But in effect, if you sign up with the RCMP and then switch to a private police force, well, you're on the hook, obviously, because you've got your local police force, whether it's a municipal police force or, I don't know, a provincial police force. You have to pay for that. The federal government isn't going to pay for that. They're not going to subsidize that police force. So if you move back, if you go, oh, there's some things I don't like about having my own police force, and you move back, you lose that subsidy, whether it was anywhere between 10 to 30%. All of this being particularly relevant to the conversation in Coaldale. From 1905 to 1916, the town of Coaldale was under the jurisdiction of the provincial police force. Those policing services were provided by the RCMP. From 1917 to 1931, they received their police services provided by the Alberta Provincial Police. Then that stopped being a thing. From 1932 to 1953, the RCMP provided all of the police services under the jurisdiction of the Provincial Police Service. In 1954, though, Coaldale decided that they were going to go at their own. They said, hey, you know what? We don't want to have the RCMP. We want to have a nice little Coaldale police force. And from 1954 to 2003, they had the Coaldale Police Service. Turns out it was kind of expensive-y, though. And so they weren't able to maintain it. From 2004 to 2015, they had actually the Lethbridge Regional Police provided policing services. And then in 2016, they switched back to the RCMP. Now, this has been where the problem started, because by switching back to the RCMP, they didn't get the subsidy anymore. Now, I wonder who we could turn to for sort of an interpretation, if you will, as to why that policy was put into place. Oh, look, here's a quote from a justice minister. I understand the concern was to limit larger municipalities that hold economic viability to pay for independent police services from converting to RCMP municipal contracts merely for the 10% or 30% cost savings. Which justice minister was that? Oh, that was Tyler Shandro, because this was one of his pet projects when he was the justice minister with the UCP. Now, since 2016, the town has been lobbying the federal government and been saying, hey, we'd really like access to that subsidy. But as Tyler Shandro pointed out quite clearly, the concern has been that you don't want to have municipalities switching back and forth based on how they think they're going to see the most effective cost savings. You don't want to see people switching to the RCMP away from their existing municipal police services because they think it's going to save them a little bit of money. Hey, there wouldn't happen to be any tape of, I don't know, the mayor of Coaldale speaking to this issue at all, would there?
Paying extra, we could use that because right now we're looking at building a new swimming pool. We're looking at a second sheet of ice. We have roads that need to be repaired. We have sidewalks that need to be replaced.
Oh, so it was about the savings. It was about maybe if we got that discount, we could build a hockey rink and a swimming pool. Now, to be clear, totally understand the desire to have a hockey rink and a swimming pool. That video, by the way, was from June 2022. Well, the province announced they're going to step in and they're going to pay the difference to cover the policing costs for the town of Coaldale to continue to use the RCMP, but the province is going to cover their discount. It's almost as if that's in an area of Alberta where they really want to make sure that they maintain support or something. I don't know. But the big takeaway from this could be that if your jurisdiction that currently has a policing arrangement with the RCMP, and then you decide, I want to switch to my own police force, and that doesn't work out, you're going to be on the hook for a big chunk of money when you have to switch back to the RCMP. And all of a sudden, if you look at it through that lens, through that frame, all of a sudden it starts to make a little bit more sense why instead of just getting rid of the RCMP to create her Alberta Provincial Police Force, Danielle Smith is instead expanding the role of the sheriffs as a supplemental police force. So she can still have a provincial police force without having to get rid of the RCMP and potentially have to face the costs associated with making that change. Moving on from there, we're going to talk about this little sleight of hand I went on this week as well. There's these things called orders in council. So when we're talking about the provincial government, there's a variety of different powers that they have at their disposal. They can, of course, create legislation, and you'd better believe we're spending the back like 70% of this episode talking about some new legislation that's being introduced. That's the big, dramatic, flary one, because those are the ones that get debated in the legislature. There is another mechanism that exists, and that mechanism is called orders in council. And what orders in council are is they're when you're doing a change to an organizational thing. You're not making a legal change. This is how you can see changes to, boards of universities. Or appointments to boards of universities or appointments to organizations that the provincial government has, in effect, jurisdiction over. Well, we saw an order of council come down just a couple days ago. And it's a fascinating little order in council because there was a name that kind of jumped out. Lieutenant Governor Council rescinds the appointment of Paul R. Bay as a member of the Alberta Foundation for the Arts. Don't worry, he got appointed as chair to the Banff Centre. He's doing fine. And appoints Cynthia P. Moore as a member of the Alberta Foundation for the Arts and designates her as chair. So she's the boss of the board for a term to expire on April 9th, 2027. Cynthia P. Moore. Why is that name so familiar? Oh, that's right. Right up until the last round of elections within the UCP, with the TBA takeover, the Take Back Alberta takeover of the UCP board, and the installation of the UCP president, who was the one who attended the Let Kids Be Kids tinfoil hat convention at the Canyon Meadows Cinemas a couple weeks back. Up until that point, the president of the UCP was Cynthia P. Moore. She was the president who welcomed Danielle Smith as the new leader of the UCP. We got a picture. Look. She's like all she needs is like a lady, like a big yellow hat, and then a small little monkey known for fits of curiosity, and she'd be set. There she is hugging the new leader of the UCP and de facto premier at the time, Danielle Smith. That's who got the appointment with the Alberta Foundation of the Arts and who was appointed as the chair for the Alberta Foundation of the Arts. So I guess maybe who you know does kind of matter a little bit. Moving on from there. And this is where it's been a weird week in Alberta politics, because we're going to spend what can only be described as a disproportionate amount of time not talking about Alberta politics, but talking about BC politics, because Alberta politics are now about BC politics. It's all very strange. We're going to make sense of it, though. Want to start, though, by setting the stage with a new report it's not that new. It came out on March 11th. There's been a lot of controversy that's existed in regards to the potential diversion of safe supply. So for anybody who's unfamiliar, BC made some changes to how they're managing their opioid crisis. One of the things that they started doing is prescribing opioids, in particular a pill called hydromorphone, to allow people to use without having to worry about a toxic supply. Now, the difference between safe supply and toxic supply is safer supply. Safer supply is manufactured by actual pharmaceutical companies. There's standards. You don't have to worry about diabetes meds or rat poison or drain cleaner getting into the drugs, because they're all manufactured by established pharmaceutical companies. Regular street supply, you never know what you're going to get. So what safer supply is in theory designed to do is to ensure that people who are going to use drugs anyways are getting a reliable, consistent, measured dose of the drugs that they're looking to use. There's been a lot of controversy around this for a whole lot of different reasons, and this is going to take up a big part of the show tonight, because there's some people who have feelings about that may not be necessarily based in, what's the word I'm looking for, evidence. One of the things that has come up is there have been seizures of pills that appear to be hydromorphone. Now, there's some important things that you have to stop and think about here. Anybody who's familiar with the opioid crisis, when it first started up, when we were dealing with OxyContin, one of the big pieces that we saw a lot happening was people were buying pills that they believed was OxyContin. They thought was OxyContin. It looked like OxyContin, but it was instead this synthetic opioid. The name of that synthetic opioid might be familiar to you, because those pills that looked exactly like what people were expected was going to be OxyContin was actually fentanyl. So there's a long history of the illicit drug suppliers making products that looks like the other products, not only to imitate it and displace it, but also make a lot of money. So just because a pill looks like a thing, until it's actually been properly analyzed, properly looked at, there's no way to know for sure whether or not that is in fact diverted supply or if it's a knockoff. It's the wish.com version of hydromorphone. Well, according to this story, that's been getting quite a bit of circulation, and this goes back to March. So I want to be clear about this because the questions around diverted supply have been going on for quite some time, since BC started that. And there's been a lot of people who have been recycling, let's go with old news, to try to get people deeply worried about displaced or redirected safer supply. According to this article, there is no evidence of widespread diversion of safe supply drugs, British Columbia's Solicitor General and the RCMP said Monday, after federal opposition leader Pierre Poilievre and Alberta Premier Danielle Smith cited a recent drug seizure to criticize the province's program. Mike Farnworth, who is the Solicitor General, told reporters that he had spoken to the RCMP's commanding officer in BC about the seizure in Prince George and was told the idea that there is widespread diversion is simply not true. So, BC RCMP and the Solicitor General in BC are saying, yeah, no, it's actually not diverted stuffs. Assistant Commissioner Brewer said in his statement Monday that there is currently no evidence to support a widespread diversion of safer supply drugs in the illicit market in BC or Canada. Farnworth said in the hallway of the legislature that both politicians should have waited for more details. And I love this quote. I'd like it if everybody could remember this quote as we go through the show tonight. Basing your statements on single news reports without waiting for all of the information is not the right way to go about things. You don't say. Now, why does this get to be so very, very pertinent? Well, this is where it all comes together. And we're going to get a little bit into the weeds tonight because in order to make sense of all of the moving parts that are associated with the new legislation that the province of Alberta has introduced and how it has sort of spun off a couple of major story pieces, it's going to take a little while to sort through it all. So, to start with, we have to talk about the press conference that happened a few days ago where Danielle Smith and Rick McIver announced that there was going to be a new bill. This is going to be Bill 18. And this bill is going to be a bill, in effect, we're going to get more into details into the bill in just a sec here, but this bill is in effect going to say that no provincially regulated body is allowed to make any sort of deals with the federal government without the province's approval and involvement. But I'll let Danny sort of explain one of the big motivators for this bill.
To allow the federal government to come in, work directly with a provincial entity that we give a regulated mandate to, and circumvent the things we want to do. Like we were simply just not going to allow them to go down a pathway of supporting safe supply in this province. We're looking at what's happened in British Columbia, having the nurses talk about what a disaster it is there, how they've gone down a pathway where now they're expected to give crack pipes to patients in the hospital wards and not even confiscate their drugs or their weapons. That is not a path we're going down here.
Wow, so much to unpack there. So Danielle Smith talks about nurses having to pack crack pipes for patients. She talks about not being able to nurses not being able to confiscate drugs, and she talks about nurses not even being able to take away weapons. That all sounds very, very, very dramatic. But what does it all come from? Why is she making these claims about poor little BC? Well, it turns out a big part of the claims that Smith made there actually have to do with a memo that was released, if you will, by the opposition party in BC, BC United. So a BC United MLA, I think they have MLAs over there. I should have looked that up. A BC United MLA, we'll call them MLAs for tonight. You can correct me later. BC United MLA got her hands on this memo, And this memo said some very, very scary things. There's a couple of things that are important to keep in mind with this memo, though. This memo was for one hospital. It was one hospital in northern BC. This memo was generated immediately after the decriminalization of illicit substances for personal use. Now, that's in and itself something that we need to unpack a little bit. So what did BC do? Well, basically what BC said is, hey, we can't have people going to jail just because they're carrying a small amount of a drug. It's a small amount. It's clearly not a drug that they're going to be selling for money because it's a small amount. And they picked 2.5 grams as the amount of any drug. Anything. Let's keep it simple. If a person's carrying 2.5 grams or less of any drug, that is not a criminal offense in BC. Okay? So that's an important piece. So it's not a criminal act in BC to have 2.5 grams or less. But what's the actual memo? Well, that's an important thing to take a look at. We're going to do that right now because there's some really important pieces that have been really misrepresented. So, to be clear, this seems pertinent. The memo was sent out on July 7th of 2023. So the memo is a year old, almost a year old. From the first part of the memo, we've recently had an increase in admissions of patients with possession of substances and using substances while in hospital. Questions have been asked with requests and report follow-up. Therefore, I've reached out to the NH regional team for guidance. Therefore, under direction from risk management and professional practice. And then we get into sort of the nuts and the bolts of the thing. Possession of a substance of 2.5 or possession of a substance or 2.5 grams of substance is no longer an offense. And a new CPS related to this is going to be published within the next month or so. It's in its final stages. So it's already acknowledging there's going to be a new policy that's coming out in about a month. We're just trying to bridge the gap here. With decriminalization of possession of drug substances, small amounts for personal use, staff should not be searching a patient's personal belongings and taking away or holding on to these substances because it's not a criminal offense for them to have those. These can remain with the patient. In circumstances where it is required, example, psychiatric intensive care, staff are required to follow the safekeeping of patients and residents' valuables policy. And then we get into all of the things that Danielle Smith and BC United got very obsessed about. Staff do not go through patients' personal belongings whatsoever. It's illegal and warrants possible charges being pressed against staff, which is therefore a reportable offense. We have been directed to not supply needle stick proof gloves as well. We will not be going through patients' property. So what this memo is saying right out of the gates is you can't search people's stuff because it's illegal. It's a criminal act. We're not going to give you needle stick proof gloves to do that criminal act. Hope everybody's okay with that. Staff do not remove personal items from a patient's room, even if there's a knife or something considered as a weapon under 4 inches long. We use our best professional judgment on this and risk of violence factors. The patient is asked to lock it up or ask someone to bring it home for them. So again, it's not saying that they're allowed to just have their thing and brandish it or whatever. If somebody identifies something that is considered to be a weapon, they're asked to lock it up or have somebody remove it from the premises. We don't remove substances or vape pens, pipes, or anything of the sort. They remain with the patient. Staff do not call RCMP to go through personal items for a patient and do not call security to do the same. Police are only called for gunshot wounds and stabbings and related concerns. You can understand how if the RCMP were being called for every single patient who brought in a backpack, that would be a little bit much. We can offer to lock up items for patients instead if they wish to do so. Patients can use substances while in the hospital in their rooms. Now, this is where the details get to be important. They can either be provided with an Narcan kit or have one available. If a patient is overdosed on substances, we can use Narcan and provide teaching. If patients are vaping in their room, they are asked to put it away and smoke in designated areas outside. If it poses a problem and consistent, then it's escalated to having it removed, but only then it is taken away. We offer to lock it up for safekeeping. We do not restrict visitors if we suspect patients are bringing in substances. Only restrict if they're violent, intoxicated, or posing a problem. We won't restrict if they're dropping off substances or suspect the same. So, when you actually read all of the points of that memo, it kind of changes a little bit what Danielle Smith presented. So Danielle Smith said, oh, they're being forced to load up crack pipes. We haven't been able to find any corroboration of that. She says that they're not allowed to take away their drugs because it's not illegal to have those drugs. They're not allowed to stop them from using drugs. Well, it depends on how they're using them. It says here in the policy very, very clearly that if they're producing any sort of vapor or smoke, that's not okay. But if somebody's taking a pill, that's not affecting anybody else. So there's some nuance that needs to be paid attention there. In regards to the weapon piece, what this is saying is that if there's no safety concerns, and if somebody has a knife under 4 inches, which isn't that big, don't confiscate it because it is their property. They can have it checked in with security. But if the person just has a pocket knife, then they just have a pocket knife. You can ask them to check it. You can ask somebody to take it away, but you're not going to ask a nurse to forcibly remove that item. And why is that? Well, if we move on to the next section of the memo, it says very, very clearly, we are not law enforcement. We have never been responsible for ensuring patients/clients are not in possession of unlawful substances. Our responsibility is the safe care of our patients' clients with the idea that when thinking about safety, we're considering the safety of the patient, our other patients, visitors, staff, and physicians, all within the balance of what is reasonable. Substance possession/use in and of itself is not the issue we need to manage or address. It is the associated behaviors. And then, with a big bullet point, smoke-free grounds policy still applies. Individuals can be directed that they need to take their activities outside. Now, with all that context, that sounds entirely reasonable. Nurses don't have any powers of search and seizure. To suggest that they do is either willfully misleading or profoundly ignorant. And to suggest that nurses should be doing those things when they don't have any legal authority to do those things is either deliberately misleading or profoundly ignorant. There's some questions there. Now, of course, the BC government did eventually respond. A Ministry of Health spokesperson said in a statement that the policy outlined in the memo has since been superseded. And they emphasized as well, smoking or vaping of any substance indoors is prohibited. Possession. Now, they've doubled down, apparently the BC government has, and said possession and use of all controlled substances are prohibited for all clients in the emergency departments, any units where clients under the age of 18 are present, inpatient psychiatric units, and inpatient withdrawal units. So, in the emergency room, you can't have drugs there. If you're in an area where there's kids present, you can't have drugs there, which makes sense. If there's any inpatient psychiatric units or inpatient withdrawal units, you can't have drugs there. That all makes sense. And the no smoking rule still applies. But then we get into the other piece. Because Danielle Smith went on Alberta Update. I think it's Alberta Update. And she had some thoughts that she wanted to share. Now, for anybody who's not familiar, Alberta Update is the generally weekly produced YouTube propaganda, some people might say, piece where your taxpayer dollars pays so that Bruce McAllister can continue to be in front of a camera, and he interviews in an absolutely not scripted manner. You can definitely never see anyone reading a teleprompter or referring to a page in front of them. It's all very real and authentic. She went on that program later that night, and she doubled down and included a little bit more information.
On what you're seeing out of BC.
Well, I hope you can do a little bit more on that, because I did table in the legislature this week the column by Adam Zivo, and it paints a pretty harrowing story for our frontline nurses because of what they call decriminalization and safe supply. They basically have government funded hard opioids that they give to addicts. They have interpreted that to mean that nurses are not allowed to ask people to stop smoking crack. They're not allowed to take away weapons. They're not allowed to stop their drug dealers from showing up. In fact, it's gone so far as they're expected, in the name of harm reduction, to pour alcohol for alcoholics and provide crack pipes for those who are smoking crack. What they're seeing happen is that the drug addicts are asking for 20 crack pipes and then going out and selling them on the street. There's even one terrible story of a pregnant nurse after she'd had her baby. She was counseled not to breastfeed because of the exposure to secondhand fentanyl. That is bananas.
It sure is bananas, mostly because at least half of what Premier Smith said there, we've already kind of debunked, and the rest because it's not, what's the word I'm looking for here? Accurate is the word I'm looking for here. So, a bunch to unpack there. First of all, she talks about the loading of the crack pipes and the weapons and the drugs, and we've already addressed all of that. But now she's added in this new thing where nurses are pouring alcohol. Well, they do that in Alberta too. There are programs inside of Alberta Health where nurses do, in fact, provide alcohol for people who are experiencing severe DTs, or delirium tremens, which is severe alcohol withdrawal. And why do the nurses have to do that? Because one of the first signs of DTs is shaking really, really badly. And if not addressed, it can lead to seizures, which in turn can lead to death. This is fairly well known. And if Danny bothered to take a look at a little bit of history of the province going back a whole, 3 to 4 years, she would know that one of the biggest reasons why liquor stores remained open during all of the COVID times was because if the province of Alberta had said, we're going to close everything, including the liquor stores, then the number of alcoholics out there who would have gone into DTs and experienced severe medical emergencies, that number alone could have easily overwhelmed the healthcare system. So it's not inconceivable that providing those people with alcohol, if they're not ready to go to detox, if they're not ready to go for treatment, if the reason that they're in the hospital has nothing to do with their withdrawals, that they would be provided alcohol. Now, in Alberta, it's a very small number. And in BC, it's a very small number. But for Danny to bring this up as if, oh, can you imagine? It's just so horrifying that we do it here too. And I'm talking because I don't know anything about the things. Because that's exactly what happened. But let's get into this Adam Zivo, as Daniel Smith said. So there's a lot to unpack here. First of all, she's kind of referencing two things obliquely, because the Adam Zivo story actually only refers to one nurse. He includes a link to another story that was done by Czech News, where they have multiple nurses who are sharing stories of how the opioid crisis has affected behavior in hospitals. But again, let's be really, really clear here. When we're talking about the policies, even if we go to the memo, it says no smoking in the hospitals. So if there are people who are smoking in the hospitals, those are people who are breaking the rules. And they're doing that because there's an opioid crisis. BC has been experiencing an opioid crisis much more visibly than Alberta for quite some time. And a lot of that has to do with how densely the population is packed in certain areas. But if you're talking about people who are using in hospital rooms or exposing nurses to inhalation use of drugs, which shouldn't be happening, it's important to remember that the rules say, the rules that have been in place for this entire conversation from the memo forward, from decriminalization forward, the rules say that's not allowed. So it becomes a question of enforcement, not the BC healthcare policies. But that's something that Premier Smith is apparently willing to just burn right past because it's politically expedient to do so. There was a quote I had earlier. I'm just gonna try to find it before we get into the Adam Zivo bit. It was something about how you should make sure that you have all of the information before you speak about a thing. Basing your statements on a single news report without waiting for all the information is not the right way to go about things. So Adam Zivo refers to the Czech news story to bring up all of these anecdotal stories. He refers to, in his story, a single interview that he had with a single nurse. So there's some context that has to go on there, because it does heavily reference this Czech news story. And like I said, the anecdotal reports of a single nurse he calls Lily. Lily said that she was told by hospital administrators that it was fine for patients to have large knives just so long as they were polite and didn't threaten anyone. Now, large, 4 inches pocket knife. There's some people who say 4 inches is very large. There's some people who say 4 inches is very small. That turns into a whole separate conversation. But if they're polite and they're not threatening anyone, and they're not using that as a weapon, what's the problem? Because the thing to understand is that under the criminal code, one of the biggest things that makes a thing a weapon is the intent and how it's being used. You can have a 12-inch ratchet, and that's sitting on the table, and that's not a weapon until you decide to try to use it as one. And then it absolutely becomes a weapon. And again, it's kind of surprising that Lily didn't know that as a nurse, she doesn't have powers of search and seizure. She recalled one man who came in with a big, fat, long axe. And as the weapon could not be confiscated, it was simply checked in with security and held for safekeeping. So somebody brings in an axe, and people go, that's an axe. That's not great. And instead of stealing it from that person, which seems to be the thing that Mr. Zivo and Lily are advocating for, they just locked it up until the person was done at the hospital. Oh no. What a crisis. The person handed over the axe and it was secured. Problem solved. But apparently, according to Adam Zivo and Lily and Danielle Smith, that's just not good enough. If we see something that's scary, we should just be able to take it away. Which is a fascinating approach to criminal law. But we can't talk about this particular story without also talking about the author of the story. Because Danielle Smith said, I tabled this story. It was so shocking about something that's happening in another province and being grossly misrepresented and ignoring the actual law that underlies the situation. I felt like it should be tabled in the legislature, so I did. So we got to have a little bit of a conversation about the author of that piece and a few others, Adam Zivo. And this is where we're going to go down a little bit of a rabbit hole. Adam Zivo is a writer. Again, he calls himself a journalist. I'm going to call him a writer. I'm going to maybe call him a creative writer. We'll see how we go throughout the show. But Adam Zivo is a writer for the National Post. And, it's if we take a look at his stories, I wonder if we'd see any kind of a bias that starts to show up there. Oh, we certainly do. Adam Zivo, the danger of puberty blockers for kids has never been more clear. Adam Zivo, we've absolutely lost control to drug users, desperate BC hospital nurses say. Adam Zivo, BC's drug policies are a joke. Adam Zivo, Auditor General report on BC safe supply should have come with a whitewash alert. Adam Zivo is the BC Coroner's Office, BC Coroner's Service, actually measuring the harms of safer supply. Zivo, Queen West business owner, alarmed by local. I could go on. You get the sense. Adam Zivo really doesn't like. He doesn't like drugs. He doesn't like drug users. He doesn't like the safer supply piece, and apparently he's got some beef with trans kids too. So there's that. But writing for the National Post isn't actually his only jam. Adam Zivo is the founder and director of an organization called the Center for Responsible Drug Policy, and I mean, he takes a great picture. It's a great picture. I wish I could rock a t-shirt like that, but I can't quite pull it off like that. I don't know that I'd be brave enough to pull it off that way. Adam Zivo is a journalist, policy analyst, and social entrepreneur. I'm not sure what that is. He's best known for his columns on the National Post and for founding and directing Love is Love is Love, an LGBTQ advocacy campaign in the late 2010s. He holds a Master in Public Policy from the Munk School of Global Affairs and Public Policy. He is the board founder of the Center for Responsible Drug Policy and the director for the Center for Responsible Drug Policy. Hey, what kind of stuff do they talk about? Oh, the bad evidence behind safer supply. How safer supply undermines recovery. Is safer supply supported by real evidence? The prescribing politics of safer supply. They talk about decriminalization in British Columbia, and is there a human right to drug use? So just going through the videos they produce, it almost seems like the Center for Responsible Drug Policy has, I don't know, maybe a little bit of a bias. But when we start to look at what are the actual policies and what are their values, well, they do have a section of their website for that. So if we go and take a look at that, we can see Canada must scale up funding for combating addiction. Canada's current model of safer supply isn't working. A significant portion of the drugs being distributed by Canada's safer supply programs are being resold on the black market, leading to an increase in public access to those drugs. Wait, didn't we just do a thing about a story where the RCMP and the Solicitor General said that's not happening? That's so weird. Why would this be on that website when all of the official sources of information say, no, that's not happening? Square that circle. A drop in street prices and rising addiction. Safer supply also appears to be causing infections among users. Many of these programs dissuade drug users from engaging in recovery-oriented treatment. These harms must be investigated and publicized, and the low-quality evidence base behind these programs must be scrutinized. Safer supply must be reformed so that program access is more controlled, dosing is more strictly supervised, and regulated substances are provided only as a temporary measure to transition patients onto recovery-oriented treatment. So they don't like the safer supply, and they want to see recovery-oriented treatment. In fact, it's one of their values. We take a recovery-oriented approach to addiction. Everyone has the capacity to recover and live a dignified life. Policies would shun or ignore recovery and enable drug use without expectations of behavioral change to value the lives of drug users by abandoning them to die in the disease of addiction. We must focus on giving people their lives back rather than just palliating drug users until they die. So, to be clear, so far, what have we learned? Adam Zivo writes for the National Post. A piece that he wrote for the National Post, which has questionable accuracy, was then tabled by Danielle Smith to provide evidence of things, even though the accuracy of the piece is subject to not actually being affiliated with reality in any way. And he also runs an organization designed to eliminate safe supply. So there's a lot going on there. And it's worth noting that the Center for Responsible Drug Policy is a nonprofit. Hey, do they have any sort of rules around donations or anything? Because you'd think if this center was receiving donations that they'd have some sort of policy. Fortunately, they do, but it's not what you think. The Center for Responsible Disease Policy, Drug Policy values transparency with its funding. Such funding may come from sources including but not limited to grant-making nonprofit foundations Ooh, I wonder if that gets relevant later. For-profit companies, private individuals who donate $500 or more to the CRDP and who wish to stay anonymous may not appear on our public list of funders. All other private individuals who donate $500 or more will be listed. All incorporated donors who give $500 or more to the CRDP in any year will be made public, with the exceptions of donations that originate from anonymous private individuals and which are trivially mediated through an incorporated entity. We're going to disclose all of our donors, except for the ones that don't want to be disclosed because we believe in transparency. Intriguingly, we spent a good chunk of time and had more than one set of eyes on the website, and we couldn't find their donor lists. So either they're not getting any donors, or they all want to stay anonymous, I guess. It's all very confusing. But that's not all that the CRDP brings to the table, because as any charity registered out of BC that has a particular policy agenda that they want to pursue, but also want to do media, they also have their own media branch. It's called Breaking the Needle, or Breaking Needles. And it's almost as if there's like comparisons that could potentially be made between this organization's model and the organization model of, I don't know, a certain post office box based organization like True North. I'm just speculating here. But they do have the media, Breaking the Needle, news source for anybody who wants to do the news with these guys. Where Adam Zivo, the journalist with Break the Needle, interviews people. Look, here he is interviewing an addiction psychologist named Julian Summers. That'll be relevant in just a sec. Because when we take a look at the board of the Center for Responsible Drug Policy, there's 4 people. There's Adam. There's a guy who likes to make scary websites from Nanaimo. He doesn't seem to have any specific credentials about anything other than being very, very angry and enjoying monochrome websites. There's a lawyer. And then who's the 4th person on the board of directors for the Center for Responsible Drug Policy? Let's see if you can guess. Yeah, it's Julian Summers. So Julian Summers is a Vancouver-based addiction psychologist. He's served as a director of university-based studies centers in psychology, medicine, and health sciences. His body of research includes randomized trials addressing homelessness and harm reduction. He's a consulting and clinical psychologist and a distinguished professor at Simon Fraser University. But as we were going through the story, that name sounded really, really familiar. And it turns out there's a really good reason why, because Dr. Summers is no stranger, it appears, to controversy. He's spoken out against Safe Supply. He's spoken out against Housing First, and who was described in an article by the Tyee as a British Columbia psychiatrist known for his conflation of homelessness, addiction, drug use, and crime. Yeah, there was a series of stories, actually, that were done by Press Progress. Professor who claimed BC government censored him faces complaints from grad students. So there was a series of students who were attending classes that were being taught by Dr. Summers, who had some very real concerns about how he was conducting himself in those classes. Let's take a quick look at those, shall we? Well, it turns out that some of these complaints were pretty serious. We write this non-exhaustive letter after 5 weeks of class and coursework, throughout which Dr. Summers has displayed a pattern of behaviors and conduct which have created a space in which we feel unwelcome, unsafe, anxious, and unable to learn. He discussed mental health diagnoses in accurate and stigmatizing ways while presenting as an authority on the topic. He has discussed suicide and self-harm without appropriate context, and it goes on from there. That section of the letter ends from our perspective. His pedagogical approach has been unprofessional, unprepared, and disorganized. General concerns regarding his class instruction. Dr. Summers makes it clear that he grades students based partly on participation, but has done little to facilitate healthy discussion. As of 1st February 2023, Dr. Summers is still not provided with a full syllabus for the course. Dr. Summers appears to come to class unprepared, disorganized, and does little to direct the class in a generative way. Dr. Summers will occasionally set up a PowerPoint, but has never made it a point of discussing the first slide. As of 3rd February 2023, Dr. Summers has not provided rubrics for the assignments he plans on grading students on. Dr. Summers continuously veers back to the topic of addictions, substance use, and harm reduction, despite a small fraction of the class studying these themes. After being challenged slightly on the topic in the first class, he changed the syllabus to exclude writing on the stated themes, but continues to bring them up in class. So many students are left out of the discussion, they are being graded on and limited in terms of critical engagement. In discussion of very complex subject areas, he has omitted wide areas of literature and evidence, instead presenting what appears to be a very specific personal viewpoint. But that's not all. Like I said, they did a bit of a series. And there was another piece that went on just a few months prior. So the second piece comes from January 9th, 2023. The National Post claims an academic was censored for criticizing BC's safe supply policy. And it turns out that's not quite accurate. The long and the short of it is Dr. Summers had a research policy that was ending, and the government said, hey, because of the freedom of information and the privacy rules, we need you to scrub some stuff. And he felt like he was being canceled. And if you haven't guessed by now, because I said the National Post claims an academic was censored for criticizing BC's safe supply, and that wasn't accurate. If you haven't guessed by now who the author of that not quite accurate, sensationalistic article was, it's okay. We found the article. And who's the writer of that article there? Let's see if we can find it. Oh, look at that. It was, in fact, Adam Zivo. Adam Zivo, the silencing of drug addiction experts who criticize safe supply. So Adam Zivo wrote a story about the guy who's on the board of the organization that he founded and directed that was inaccurate, and the university and the government said, no, that's not quite what happened. You're mischaracterizing it. And then he had him as a guest on his podcast. We watched the first couple of minutes, and nowhere in the podcast did he say, oh, by the way, Dr. Summers is also on the board. So I guess there's more of that transparency in line with their donation policy and the not having any published donations that we could find. It's all very confusing. But of course, there's more. It's almost as if Adam Zivo has built something of a personal brand, if you will, as despite, to the best of our abilities, not having any clinical expertise or training in addictions or addictions treatment or any of those things. He likes to talk about these things, not just in the National Post. Here's a tweet from Adam Zivo. Gosh, that was on April 10th of this year. Last night, I presented to 7 MPs about the harms of safer supply. By the end of the event, there was a clear consensus. We need reform immediately. Thank you to everyone who made this happen. And Layla Goodridge in particular, because there's that UCB connection. Not only that, Mr. Zivo is he appears to be a big supporter of the conservative movement in general. Here he is just a couple days ago at the Strong and Free convention, which is, for anybody who's unfamiliar, a big conservative convention where all the conservatives get together and, I guess, tell each other how awesome they are and get upset about free tampons in airports. It's all very complicated. And this is sort of the kicker to the whole thing. We've got an episode coming up where we're going to be talking with somebody who does have experience in addictions treatment, who does have significant experience in helping people who are dealing with addictions. That person, part of the conversation we're having with them is because they were blocked from attending the Recovery Capital Conference just because they appeared at an event with some other people who had some stronger views. This person, I'm talking about Guy Felicella, has never attended, never espoused any of the views that the other people espoused, but just by affiliation enough. That was enough that he had to stay home. But look, Adam Zivo was a presenter at the Recovery Capital Conference, and we decided to take a little bit of a look at the presentation because we're just a curious bunch over here. And he did a panel with I was going to try to get through this without laughing. He did a panel discussion with Among others, MP Garnet Jean-Louis, who has no experience in any of these things, and it's quite a fascinating little panel. There's two pieces that we want to share with you here. The first one is the summary of the panel discussion that Mr. Zivo did. Canada's federal government, along with some provincial governments, believe that safer supply programs are an effective intervention for reducing overdoses and drug-related deaths. However, there's compelling evidence that most of the drugs distributed through these programs are diverted onto the black market. Again, the RCMP and the Solicitor General for BC says there's not, and that these diverted bugs are spurring relapses and new addictions, especially among youth. Oh, the kids! What did anyone think of the kids? Organized crime is allegedly profiting from the abuse of safer supply programs, and it appears that even when used as intended, some safer supply drugs can cause debilitating infections. Government stakeholders and public health researchers have been reluctant to explore the harms of safer supply, and in some cases, they've been actively hostile to the possibility that the intervention may not work as intended. As such, much of the evidence of safer supply's harms has come from journalistic sources. And now we get to the tire pumping. Adam Zivo is Canada's leading journalist on this topic. In May 2023, the National Post published a 10,000-word expose of his, which outlined the problems of safer supply. He has since written several follow-up articles on this issue. In this session, Zivo will summarize his findings, describe the challenges of reporting on this topic, and address some of the main criticisms of his work. Now, I mean, Canada's leading journalist, that's a pretty bold claim to make. And in fact, a lot of the things that are in this summary are pretty bold claims to make, especially given the available evidence and the actual police who investigate the things saying, not so much. But where it gets to be fun is we decided to read the other bios. We decided to read Mr. Jean-Louis, Garnet Jean-Louis. We decided to read his little blurb, and it revealed something quite fascinating. As a member of Parliament, I have a unique window into public policy debates, rana, but the whole thing is written in the first person, which suggests strongly that MP Jean-Louis, he wrote his own bio. And if Garnet Jean-Louis wrote his own bio, I mean, bio also works, but if he wrote his own bio, it stands to reason that Adam Zivo would have written his own bio. And if that's the case, the section where Adam Zivo is Canada's leading journalist on this topic takes on a little bit of a new light. Now, to be clear, we don't know for sure that Adam Zivo somebody else didn't write that for him, but we feel like the odds are probably pretty good. Now, there's one other big piece that we got to add on to the Adam Zivo conversation. It's not like we're dunking on Adam without having ever had an effort to have a conversation with him or have him on the show, because several months ago we did have a conversation with Adam where we said, "Hey, we'd love to have you on the show. You got some thoughts, man. Would be fascinating to have a discussion on this." And he actually initiated that conversation on the Twitter machine, where he was challenging some of the things that we were saying, and we were challenging some of the things that he was saying, and he said that he'd love to have a debate on the show. And we said, fantastic, let us know the when and the where. And then we exchanged some emails, and there were some DMs, and oddly, he never committed to a time. We'd still more than welcome Adam to come on the show, because we'd love to hear how he explains the fact that his columns seem to be opinion, not journalism, how they seem to be dissociated from official government statements and arguably facts and reality. We'd love to know how he justifies that. So, Adam, if you're listening or you're watching, we know you've got our emails. You can there's a little reply button. You can just smash that reply button. We'd love to have you on. moving on from there. To transition away from this whole BC piece and get into the two other big pieces that have to do with Danielle Smith's new bill, it's worth letting the closing words on this whole BC subject come from the minister of chugging beers in the legislature and conscious rights, Dan Williams.
Important to note that right next door to Alberta is a very different policy framework. The landscape there is different. What they have done is they've taken, and I'm not overstating this, the world's most radical policies anywhere found on earth when it comes to addiction. They've effectively decriminalized the use of all drugs, including in playgrounds and in schools, and they have effectively allowed it in practice in their healthcare facilities, which is what you and the Premier were talking about, where nurses are concerned to breastfeed because they may have inhaled secondhand fentanyl smoke and were recommended by their health professional not to breastfeed their own baby. I mean, it is, as in the Premier's words, bananas and beyond insane. And so that is an option on offer for Canadians, one that says government supplies taxpayer-provided high-powered opioids, 5 times more powerful than heroin, to the tune of 60-odd million pills a year, right? And then we're going to decriminalize the use with no sense of recourse for the law to try and get people into treatment and help and support they deserve. Alberta, by contrast, has rejected that and has said, you as a Canadian, as an Albertan, as a human, have a sense of dignity and worth, and we have a responsibility to give you that opportunity to recovery.
I mean, again, there's a lot of things that Dan Williams says that's false, but there's one thing in that comment that's particularly telling, and that's where he talks about the fact that the real problem with decriminalization is it takes away the leverage to force people into treatment. It sounds like Dan's big argument for keeping the criminalization of drugs into place is to use those criminal charges not to address crime, not to deter crime, not to do anything in regards to incarceration, but to use the threat of criminal charges as leverage to try to force people to accept treatment, perhaps before they're ready for it. That's not great. And I'm going to be totally honest. I was looking at the chat while that video was playing, and I love that it was asked. I love that this question came up. Apparently, the chat would like to know what's in the bottle. It's lemon, lime, Crystal Light water. That's all. It's just a little bit of fun flavored water. That's all there is. Moving on from what is Nate drinking in that bottle. Let's get into the impetus for that whole segment, which was Bill 18, because all of that stuff came out of Bill 18 being introduced in the legislature. So what is Bill 18 is probably a really good way to start this conversation. And we can look, because it's been tabled, we can look right at what the legislation says. And in effect, what it does is it has specifically to do with intergovernmental agreements. So these are agreements between the municipal government or, as it says in the legislation, any provincial entity and the federal government. Any approval to enter into, amend, extend, or renew an intergovernmental agreement may include terms and conditions on the approval of the province. So no intergovernmental agreement shall be entered into, amended, extended, or renewed on behalf of a provincial entity unless, I use some words here, but unless the province says so. Now, where it gets even more interesting is towards the end. a provincial entity, a class of provincial entities, an intergovernmental agreement, or a class of intergovernmental agreements may be exempted from a requirement of prior approval to enter into, extend, renew an intergovernmental agency in accordance with the regulations. A minister authorized by the regulations or another person or entity authorized by the regulations may exempt a provincial entity, a class of provincial entities, an intergovernmental agreement, or a class of intergovernmental agreements from a requirement for prior approval and to enter into, amend, extend, or renew an intergovernmental agreement. So, long and the short of it is, what this bill says is you can't, as a provincial entity, and we're going to define what those are in just a sec, but you can't, as a provincial entity, engage in any sort of negotiation with the federal government without the province's approval. And if you do, any agreements that you make will be considered null and void. Now, a lot of the conversation so far has had to do with, in particular, municipalities, because this came out of concerns by the provincial government that they were left out of the agreement for housing. So for anybody who's unfamiliar, the federal government has recently come forward and said, hey, Edmonton and Calgary, we hear you have this housing crisis here. We'd like to be able to help with that. But if we do help with that, we have a couple of things that we'd like on our end. The biggest one is we'd like to see some rezoning in your cities so that the whole area can be used in different ways, as opposed to having all of these different zones that are all very confusing. We want to make residential zoning all the same thing all across the board. And if you do that, then we'll give you all of this money. So there's definitely some quid pro quo going on there. And we actually have our very next episode is going to be a whole conversation on that. We're talking because that has actually happened already in Edmonton. And the sky hasn't fallen. Cats and dogs aren't living together. It's not mass hysteria. It just is a thing that happened, and people went about their day. Calgary is in the process of doing that, but in Calgary, the NIMBYism is much, much stronger than in Edmonton. So it's turning into quite the debate, quite the argument. And the provincial government is saying, "Oh, we wanted to be part of these conversations and press releases and press conferences too, and we just feel so left out, so we're going to change all of the laws." But it's not just municipalities. It's important to realize that there are a lot of different organizations whose power flows from the provincial government. Historically, the general consensus has been leave them be. We'll appoint people to the boards that we like occasionally, maybe, I don't know, the UCP president, former UCP president. But we'll let you guys do your own thing. Just don't misbehave. So what is a provincial entity? A public agency is defined in the Alberta Public Agencies Act, a Crown-controlled corporation, a public post-secondary institution. A board is defined in the Education Act, so we're also talking about schools. A regional health authority established under the Regional Health Authorities Act, and any subsidiary of a regional health authority. A municipal authority is defined in the Municipal Government Act. A management body is defined in the Alberta Housing Act. Any other class or class of entity designated as a provincial entity in accordance with the regulations. So it is quite literally, if you have been created, or if there is legislation that allows you to have been created by the provincial government, this affects you. So it's not just municipalities, it's schools, it's post-secondary institutions, potentially museums, things like the Banff Center. It goes really quite large. So that's kind of what the bill is, and it's created quite a bit of conversation. There's been quite a bit that's gone on. We're going to deal with the municipal part first, and this is where the press conference did not go so well, maybe for the Danielle Smith and the Rick McIver, because Danielle Smith was asked about, hey, so you're rolling out this new legislation. It's going to affect literally every provincially regulated body, like all of the ones that I just listed off. Did you consult with any of them before you did this earth-shattering thing?
Why not consult the municipalities before writing the bill instead of writing the bill and then consult the municipalities?
Well, look, this is the way legislation develops. As you develop sort of a high-level principle, you look for areas that you find problems in. This has emerged as an area that we see a problem with, and now we've put forward the framework, and we'll be consulting on the implementation. And this is sort of the process that you go through from a government point of view. So I believe that we've given very clear indication to all of the municipalities the direction that we were heading. I believe we've given very clear indication to Albertans the direction that we were heading. And this has just emerged as a result of the absolute unfairness that the federal government is treating our municipalities with.
Nope. That's not how responsible legislation is historically created. Usually there is a consultation process that goes on before any such legislation is brought into effect. But one of the other big pieces of this whole thing has to do with the question of, well, what if instead of the federal government negotiating a deal with Calgary and then negotiating a separate deal with Edmonton, what if we, as the province, just got a per capita amount and then we got to disperse it how we saw fit? So what the province is saying they'd like to do ideally is have the federal government say, hey, Alberta, you deserve, I don't know, $2 billion. I'm making numbers up for the record. You deserve $2 billion of federal funding for housing. So we're just going to give you the $2 billion and you do whatever you want with it. That's what Danielle Smith and Rick McIver have said they ideally would like to see. But in the meantime and in between time, there's some other questions.
Source of taxes to to use for that too. The other point about it is too, we routinely, with our current and other funding things, talk to municipalities what their priorities are, and we look for ways to agree with them. And I don't see any reason why that cooperative and productive relationship will change. It just might be more productive because we might have more fair share of funding from the federal government that we're not getting now. We'll have more to talk about, and won't that be great?
There's just something about the way he says, and won't that be great, that just like, I don't know, it makes me really uncomfortable. It's just it's the tone and the delivery and everything. Like, I don't think he means that it would be great for everybody. So Rick McIver, he had some pretty clear thoughts on what he believed should happen. And that's what he was alluding to, is that per capita funding, rather than municipalities negotiating their own grants, their own deals with the federal government. Wouldn't it be great if the province could just make the decisions and then the municipalities had to come to them? Now, there was some other pieces that happened. Danielle Smith did a conversation on CTV's Power Play, which really kind of highlighted how big the problem's not.
Earlier this week, you had said of the 14,000 agreements that you have looked through, there are 800 of them that have been flagged as problematic. Mm-hmm. Doing a rough math, that's 0.05%. Yeah. What is so problematic about them? Can you tell me, give me an example?
Sure, I can give you a couple of examples, but I think people should be assured that that means that on most cases we'll be able to find agreement with the federal government, because in most cases of joint funding, there isn't any kind of policy angle to them that is opposed to what it is we're trying to do.
So before you give me an example, with that math, some people may say, then why do you need this at all?
Well, I can tell you one of the things that where we do have a conflict is on the issue of how we approach a drug policy. They are proponents of safe supply and decriminalization and legalization. We're a proponent of recovery. And so we want to make sure that all of the agencies that we support are aligned along that recovery-oriented system of care. That would be one example.
So the first example that Danielle Smith thinks of when she's asked, hey, why are you saying to municipalities you're going to have to go through us to get any approval for any funding ever again is, well, it's about the drugs, you see. We believe in recovery, and we don't want the federal government in any way supporting anything that is not our exclusive vision for how we go ahead and deal with the opioid crisis or matters of mental health and addiction. We want sole control over that. So we're going to take away all of the abilities for any organizations that have any sort of provincial oversight to make any kind of deals, because, my God, what if they do something in regards to the opioid crisis or the toxic supply that we don't approve of? Can you even imagine? And where this starts to get particularly pertinent is when you think about how many houseless shelters or homeless shelters exist that get federal funding. When you think about how many different treatment centers that get federal funding. So this, all of a sudden, for Danielle Smith, the first example that she thinks of as to why this 0.05% of a problem needs to be a massive change to legislature, it doesn't actually have anything to do with the municipalities. It has to do with, we're going to assert our will over this addiction and mental health and opioid crisis come hell or high water. For 0.05 of the grants that are out there that she has issues with, it seems like a whole lot of red tape to create, though, doesn't it?
Definition of red tape is an order of government, the federal government, that doesn't have a regular communication or regular relationship with over 300 municipalities, suddenly having to develop one to make a simple deal. And I will also say that, so dealing with one party being the provincial government certainly should be quicker than dealing with 300 plus. And in terms of the smaller municipalities, somebody asked an earlier question about red tape for the smaller municipalities. Well, with the federal deal, there will be no red tape because there won't be any money. So I'm sure the small municipalities will be glad to review with us the 5 to 8 agreements that they have with the federal government in order to qualify for funding. I think that's if you want to call that red tape, and I don't, but even if you do, if that's the cost, a couple minutes or 10 minutes to review 5 or 8 different agreements in order to get funding for housing, I would think most municipalities in Alberta would say, thank you very much. That bit of a red tape, we'll have more of that, please.
So Rick McIver's read of the room is that because small municipalities didn't get access to, or haven't yet been included, I should say, in funding for affordable housing, they're going to be totally on board with having to review all of their other agreements, because a small municipality of 1,000 people is now going to get money for affordable housing. I mean, so let's be clear. When we're talking about the housing crisis that exists, we're talking not so much about rural areas, we're talking about urban areas. If you're willing to go a couple of hours away from a major municipality, the housing prices drop off real fast. So is there that big of a crisis of affordable housing in rural Alberta that requires this sort of rule change? And are municipalities going to be in love with this idea? One would think that the minister in charge of all of these things would have maybe done some consultation.
And while we haven't consulted in detail on everything in the legislation, in broad terms, we have had discussions with municipalities. I raised the possibility of this legislation recently in speeches that I gave at rural municipalities of Alberta and Alberta municipalities. And I can tell you the 300 plus municipalities that so far are getting zero from the federal government are very much in favor of us getting fair funding for Alberta, because if we don't, there's a very high possibility that most of them will get nothing. So while they haven't been fully consulted, I would say that they are in favor of us having more money to spend with municipalities instead of less. That at the end of the day, that has to be better for more municipalities, has to be better for more Alberta citizens that need housing and other services that come through the provincial government. So, and we talk to them all the time. So the additional consultation that needs to be done, we're in touch with them constantly. We will get right to work as the legislation is passed in doing that, and we feel very good about our ability to come to terms.
There's something just about Rick McIver winding down on a statement that I just get really uncomfortable with. I don't know what it is. But, he's very, very clear there. The municipalities, we told them that we might consider something like this. They shouldn't be surprised, and they're going to be in favor of it. But again, you can hear in what Rick McIver's talking about there, he's kind of conflating the housing issue with the end goal of getting per capita housing that is all routed through the provincial government, because for some reason the federal government would agree to that. That reason hasn't been identified, so do with that what you will. But, how quickly did all of the municipalities voice their roaring support, their enthusiasm, their gratitude to Rick McIver and Danielle Smith for this thing? Well, it didn't take the mayors of Calgary and Edmonton very long. Both Mayor Jody Gondek and the mayor of Edmonton, Amarjeet Sohi, issued statements very, very quickly saying, "Oh, this is not good." From Jody Gondek, the proposed legislation announced today requiring provincial intervention in all funding agreements between municipalities and the federal government will stifle Calgarians' ability to have their hard-earned tax dollars flow back to their communities. I have fought hard alongside Canadian mayors to push the federal government to fund us properly after a 2.5-year battle that finally resulted in $6 billion announcement last week. The provincial government's control issues will take away what rightfully belongs to Calgarians. Further, this legislation impacts municipalities, post-secondary institutions, school boards, and others. So that's a lot more than 300 plus municipalities. It could be thousands of entities that have their ability to access federal funds severely curtailed. Calgarians are caught in the middle of a provincial and federal ideology battle. While we wait for a provincial review of agreements, other cities across this country will be eating our lunch. They will happily take what we can't have. This legislation is overreach and red tape. From Amarjeet Sohi, the Provincial Priorities Act creates unnecessary complexity and red tape. I guess they don't like the red tape, at least the mayors of the cities that represent roughly 2/3 of the population of the province. This legislation will stifle economic growth, stall infrastructure projects, and cause investor uncertainty. The added barrier will slow down investment and hurt our ability to keep up with growth. Municipalities are getting caught in the middle of a fight between the province and the federal government. I will be reaching out to other public sector organizations and impacted stakeholders to discuss the impact of this legislation. The elected leaders of 2/3 the areas that 2/3 of Albertans live in, they were not super duper thrilled. But Rick McIver would probably say something, and Danielle Smith would probably say something to the effect of, "Oh yeah, but that's because Calgary and Edmonton got the deals. They got the big deals with the federal government. Of course they're going to be unhappy because now they've got to go through us." Really, though, what we were doing this for was rural Alberta. All of the municipalities, the 300 some odd municipalities that are small towns Alberta, we're doing it for them. I wonder if those folks had any thoughts on this issue. Oh, they did. From the rural municipalities of Alberta. The requirement for provincial approval of all funding agreements reduces municipal autonomy, increases red tape, and could delay or even exclude Alberta municipalities from receiving federal funding support for local events and projects. At a time when municipalities of all types across Alberta face growing infrastructure deficits, heightened expectations to accommodate residential and industrial growth, and downloaded responsibilities from other levels of government, cough, provincial government, cough, adding more red tape to funding access is the last thing Alberta municipalities need. While the RMA is hopeful that there will be an opportunity to work with the Premier and Minister of Municipal Affairs to develop exemptions and design a streamlined provincial approval process, engagement with municipalities on this issue prior to Bill 18 being drafted may have led to an alternative approach to harmonizing provincial and federal priorities without reducing further risks to municipal sustainability. So that is right there. That's the Rural Municipalities Association. And they're saying, hey, maybe if you'd written this law in a sensible way with consultation, it wouldn't be such a dumpster fire. Now that you've done this big thing badly, though, maybe please talk to us, please. That would be super great if you could do that. Also, they didn't like the red tape. So I guess they were like, yes, more of that red tape, please. But they're not the only organization that weighed in. Alberta municipalities that represents, they have 265 municipalities. That's almost 300. We cannot help but notice that the provincial government has pivoted from its original rationale. Initially, it said the legislation was intended to ensure Alberta receives its fair share of federal funding. Now its justification was that the legislation will ensure federal funding aligns with provincial priorities. Yet again, the provincial government did not consult or communicate with our association on legislative changes that, if introduced, would profoundly affect the way municipalities work. Had it consulted with AB munis or municipalities, we could have suggested ways to improve and streamline agreements between municipalities and the federal government to ensure that Alberta gets its fair share of federal funding in a way that respects the priorities of Albertans. The provincial government's communication around Bill 18 has been unclear, leading to confusion among affected entities about whether or not they should still apply for federal funding that is being offered. That is both of the organizations that Rick McIver cited in his answer about consultation, saying, we got blindsided by this. We wish you'd talk to us about this. And also, the red tape is going to be an absolute shit show for us. This is the problem right here with a provincial government that believes they've identified a problem and then just bulldozes their way through it. Damn the consequences, damn the costs. But it is particularly interesting that both Alberta municipalities and the Rural Municipalities Association were so quick to get their statements out. Their clear statements out, expressing their clear frustration with the lack of consultation and their clear frustration with the increased red tape. It's almost as if they learned from that time that Danny tried to pin the renewables moratorium on them, and it wasn't actually them that asked for it. It's almost as if they've learned that when this government moves in a given direction, if you don't immediately do something to clarify your position and, if appropriate, disassociate yourself from the direction that the government's going, you're going to get sucked into the vortex of bullshit. I'm just speculating on that last bit there, but we're still not done with Bill 18, because there's another piece that we have to talk about in regards to Bill 18. But before we get there, before we move to the last piece, and then we have a couple of little kickers we're going to add on to tonight's show to have a little bit of fun. Before we get to that, maybe we should ask for some expert opinion on, how should municipalities have to do these things? Should municipalities have to consult, or should they be allowed to have their own space that they've been elected to be responsible for? Should they be allowed to operate and manage that space with some sense of sovereignty? And once again, huge hat tip to Disordered YYC.
Sovereignty is the level of decision-making authority. So there's such a thing as individual sovereignty, but I don't need to be a separate nation to have individual sovereignty. I just need people not to interfere with me. There is local sovereignty as well, that we should have our municipal levels of government be able to be sovereign in the decisions that they make that are within their municipal boundaries.
Which brings us to academia. And it seems like in a lot of ways we got to give mad props to CBC News reporter Janet French, because she wrote a column that came out very early in the morning on April 12th. The title of that column, Alberta Bill Requiring Provincial Approval of Federal Funding Risks Political Meddling, academics say. And among the things raised in that column was the concerns that, as I talked about, it's not just municipalities. It's any organization that exists because of authority from the provincial government. So it includes all of the education system. It includes post-secondary education. And because of I think in no small way that column and the concerns that were raised in that column and also concurrently raised on social media by academics, the question was asked of Danny, because she was in Ottawa for, oh yes, the Strong and Free conference with Adam Zivo. She was asked on Power and Politics, and things took a bit of a wild turn.
Given enough indication that the federal government uses its power through researchers to only fund certain types of opinions, certain types of researchers, and I don't think that's fair either. I think we need to be able to have a balance in our university if we're going to have a robust, free, and democratic discussion about all issues.
But the National Research Councils are depoliticized, right? It's a jury of academics or peer-reviewed, and they make the decisions through application on research grants going to university, and it's all posted publicly, so you can see what's there. But you don't have confidence in that system?
I have heard enough from some of our academics about how difficult it can be to able to access some of that funding. So we just want to do a review, and we want to just see if there's some way that we can make sure that we maintain the environment at universities, which there should be, which is that all people from all political perspectives are able to engage in a robust debate and have a robust research agenda.
I can feel some researchers at the University of Calgary, the University of Alberta, and places in your province getting anxious with that, because the universities have agreements straight with these granting agencies. It's meant to be independent to fund research that is protected by academic independence. I mean,
well,
what kind of a role do you see there for you?
I guess if we did truly have balance in universities, then we would see that we would have just as many conservative commentators as we do liberal commentators. Out of our journalism schools, we'd see just as many conservative-minded journalists graduate as we do progressive-minded journalists graduate. We don't see that. And so that leaves me to be concerned that we're not fostering the kind of environment that allows for balance, because we need to have balance. If we're going to have a balanced discussion in the broader public sphere, it begins at the universities.
I get that, but that would be an issue with campus culture, which is funded by provincial governments. This is like medical research and scientific research and humanities research that is not necessarily determining the makeup and composition of the people who work at a particular
I guess
university.
We'll see. That's why we're doing the review. We want to see what kind of things are being funded, and if there are any areas that are problematic, we'll have to keep that in mind as funding agreements are renewed.
It's the last part that's particularly chilling. We'll have to keep that in mind as funding agreements are renewed. To be clear, what Danielle Smith appears to be threatening there is we're going to go through all of the grant funding for all of the things. And if we find grants being funded that we don't like, we might just not allow those grants to be renewed. Now, it's important to highlight that the interviewer in that clip is absolutely correct. The vast majority of research grants go to things that are measured empirically. Quarks don't care about your politics. The science of medicine doesn't care about your politics. When we're talking about empirical, data-driven research, the kind of research that gives so much of the human experience a forward motion, that research is completely apolitical. It's also important to highlight that interviewer is 100% correct, and this has been posted on social media by multiple high-level academics who are part of these grant processes. Grants are reviewed and given on the basis of the quality of the work that is presented. It is apolitical. There is no conservative, are you conservative or liberal column that gets checked when applying for a research grant to determine how a particular medicine works or to determine genetic research. There's no check marks for that. Now, Danielle Smith also complains in there about, but the way that I can tell there's a problem is that we have way more not conservative commentators that are being produced from journalism schools, and way fewer conservative. We need more conservative voices in the media landscape, is what she's saying. And the lack of conservative voices in the media landscape, which is a questionable assertion to be true. One need only scroll through hers and any of her ministers' social media to see that they're referencing conservative media daily. There's not a whole lot of journalism grants out there. The vast majority of the grants have nothing to do with things like journalism because you don't research in anywhere near the same way. It's just not even comparable. Now, you might think that after a performance like that, where she says, oh no, we're totally going to look at the possibility of messing with academic research in the province of Alberta, we maybe need to look at maybe there's some grants that don't need to be renewed so much. You'd think somebody in her communications office or one of her many advisors would say, don't do that. Don't say the quiet part out loud like that. But of course, yesterday was Saturday, so we had at your province, your premier.
Bill 18, concerns by post-secondary institutions. How do you respond to that?
Look, I mean, I'll respond the way I did when I was asked about it. I've noticed, and everybody's noticed for some time, that it's strange that the lion's share of professors have a particular left-wing persuasion. The lion's share of graduates have come out with a left-wing persuasion. It makes you wonder, are we overfunding on one side and not being very balanced on the other? And so I want to kind of see the kind of grants that have come through. David Staples wrote a great column about this, quoting Sylvain Charlebois, who's a agri-food specialist, saying, you know what, we're not doing a lot of good analysis about the impact of the carbon tax on the food supply because no one will fund that research. And that's what I'm worried about, is are we creating a narrative because the federal government is only funding certain types of research? And do we need to use our provincial spending power to make sure that we end up with more balance? I don't want to have a single viewpoint coming out of universities, as I've witnessed for decades. I want to have a robust, lively discussion on all issues, because universities are the center of where free speech begins. And I've been noticing over the number of years that there's fewer and fewer topics that are open to that robust discussion. So we're taking a look, and we're going to see if we can do it with some more to be able to balance the equation.
Now, let's be clear. If Danny was talking about, hey, you know what, I just feel like there's no money for people to research the effects of carbon tax on the price of food, even though there are plenty of economists who have done that work. Trevor Tombe, excellent example. Even if you wanted to go down that road, there's nothing that prevents the Alberta government from creating the research grant for saying mean things about the carbon tax. They could put $5 million, $10 million in a research grant tomorrow if they wanted to. They don't have to take over control of all of these other pathways for research to be completed. And again, the federal government doesn't make decisions in regards to how research grants are afforded or given to people. It's not a federal government process. It is a process that is done by academics who examine the research proposals, and on the basis of the quality of the work and the quality of the proposal, that's how those grants get handed out. The federal government has nothing to do with it. So, again, Danny's lying, and she's totally misrepresenting the greater point. Now, there might be some people who would say, oh, but you know what? It's a big leap to suggest that the UCP or that Danny would just be manufacturing voices to they're not interested in a balanced conversation. They just want to hear the things that make them feel like they're getting things right. It's not like she's on record having said anything like that. Oh, wait. There was a story that came out of the Strong and Free conference during the Canada. This is from the article. During the Canada Strong and Free Network event on Friday, the Premier said that consulting other transgender conservative colleagues has been a helpful part in developing the framework for Alberta's gender legislation. So by consulting the people who already agree with you, who are ideologically aligned with you, you got told that what you were doing was a good thing. That is the exact opposite of how good research or any sort of scientific process works. And we don't need to look very far for proof of that, because Danny thought this is how you write legislation when it came to Bill 18, and literally both of the major organizations that represent rural municipalities said, whoa, 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 this isn't how you're supposed to do it, and you're doing a really big thing badly. Had she used a proper approach, something approximating perhaps the scientific method, if there was any familiarity with that in her entire office, rather than a purely ideological approach, then maybe that legislation wouldn't have provoked such a negative response. But that's not what it's about. It's about Danny gets an idea in her head, and she wants to hear from the people who are going to agree with her. That's all that it is. Oh, but Nate, there's no way that the UCP would go so far as to try to influence or interfere in an academic institution. That's getting close to the F word. That's almost fascist-y. There's no way that they would do that. Oh, wait, what's this? You say they already have. Back in 2022. And we've talked about this before on the show, there was a big kerfluffle around Athabasca University because the university coming out of COVID wanted to move all of their programs online. They wanted to keep them online permanently. And what that meant was that they would be able to have instructors working remotely, which in turn meant that instructors wouldn't have to live in the exact area where the university was located. And the town said, oh no, we like having those people here because they pay property taxes and they buy things. And the only thing that's been keeping this town viable is the fact that the university provides that people have to live and work here. So we'd like to keep that going, please. And Athabasca University said, actually, as we've been going through this whole process of being online during COVID, turns out it really, really works well for a lot of people. So we're going to do that. And the town said, well, we're going to tell the province. And then Demetrius Nicolaides fired almost everybody. It removed 4 public members from the board via an order in council. And it appointed 7 new public members, which changed the overall voting structure of the board. And shortly after that, the board voted to remove the president who was fighting to not force people to have to relocate, to not force those instructors that had been doing the online distance stuff to relocate. So, yeah. The UCP has demonstrated that using those order and council tools that I talked about earlier, that they absolutely will mess with academic institutions to get what they want. And what Bill 18 allows them to do is to choke the life out of any departments that they don't like. They can identify specific academics that they don't like, and they can make sure that those academics never get any federal funding ever again. That is the power that they are giving themselves through Bill 18. And it should really alarm everybody, because they're not just messing with municipalities, which in and of itself is tremendous cause for concern. Because according to this process, if a small town like Tabor or Fairview or High River or Fort McMurray or Fort McLeod decide that they would like to update their cenotaph, and there's a federal grant for cenotaph polish, rather than just saying, we're going to apply for the cenotaph graph polish, they now have to go through the provincial government to get their approval. And it's not like we've seen the UCP punish areas that didn't vote for them. Right? Edmonton? Your hospital, that new hospital you're getting, it's, oh, wait, you're not getting it, even though it was a campaign promise that Casey Madu said that he'd already secured the funding for. You can't mess with education. And there's two really good reasons for it. There is an awkward and uncomfortable conversation that is to be had about political leanings. And I want to preface this by saying, historically, in the province of Alberta, you could be conservative fiscally. There was a fiscal category where you were like, we should be responsible with the monies. And that's how many people identified conservatism. You could also then be progressive on social issues. That's one of the reasons why the governing party in the province of Alberta, even though there were many times where they were not as socially progressive as they should have been, cough, Ralph Klein, cough, notwithstanding clause, cough, you could be socially progressive because there was a conservative financial piece and a progressive social piece. Those days are gone. Conservatism in Alberta now means only social. Progressivism in Alberta now means only social. That's it. That's the ball game. The political spectrum in Alberta can now only be measured on the social scale. And when you start to look at who identifies with what, there's a really uncomfortable conversation to be had. Because social issues can very often be quite complex. They can go against the norm. They can often signify a need for change. And there has been substantial research into the question of when it comes to skills like critical thinking, where do people align? And it turns out where you have social conservatives, the critical thinking skills aren't where they should be. That's one of the reasons why, as you go through levels of education, you see patterns where there tend to be more socially progressive views than socially conservative views. Now, there's for sure exceptions. We're talking about patterns, not absolutes. So there's for sure people who will get, I don't know, degrees in economics who will still manage to come out of that whole thing being wildly socially conservative, who then go on to become the Premier of Alberta, God help us. That's a thing that happens. But as a general rule, the more education that people get, the more critical thinking that people develop, because they're able to examine these complex issues without internalizing them entirely, they tend to land on the more progressive side of things. And people who lack those critical thinking skills tend to land on the more socially conservative side of things. There's all kinds of different ways to say this. There's studies that say you can tell there's higher correlations between intelligence and political ideology. And when you say it that way, it sounds like you're saying dumber people are conservative, smarter people are progressive, but it's not that simple. The reality is people who lack critical thinking skills tend to be more socially conservative. There's good news, though, because that's only the first part of the conversation. The second part of the conversation goes that with proper education, you can develop those critical thinking skills. There's no shortage of research that shows you can boost IQ by introducing people to creative problem solving. That critical thinking piece. This is why education is so so critical because it has the ability to raise everybody. And if that means that there's more social progressives as opposed to social conservatives, that's not a bad thing. Because all of the social conservative views that we've talked about on the show that come from Adam Zivo, that come from Danielle Smith, that come from Rick McIver, on a 2-hour podcast, we've been able to prove are by and large demonstrably false, profoundly misleading, and grossly missing context. And heaven forbid that the thought leaders and the political leaders of our society are people who are able to divorce themselves from that kind of shallow, ineffective, and harmful thinking. Wouldn't that be great? Couple other topics that we want to hit on real quick before we move on from that light fare. And this one's, we're just doing this one for more fun than anything. Because we haven't talked about it. David Parker's gone kind of quiet lately. He's sort of been keeping a lower profile. He's made some big promises about how he was gonna release tapes of the interviews and show how evil Elections Alberta was for trying to enforce election law. And it's worth noting that David Parker's organization, Take Back Alberta, for which he's the director, and apparently he's the money guy now. He's the one who's filing all the reports. David Parker had a date. Because we've seen over the last couple of days, there's been all this talk about the finances for the parties. We didn't get a chance to get into that because we had so much more important things to talk about tonight. But David Parker was supposed to have in the financial reports for Take Back Alberta by April 2nd. Today is April 14th, and we just checked the Elections Alberta website today. It has not been received by the due date. Now, this comes on the heels, as we talked about last live episode, of David Parker claiming that in 2022 there were no donations received. Or sorry, in 2023, the quarterly, Take Back Alberta did not receive a single donation. So their year-end financials have not yet been turned in. Because accountability and transparency or something. And that is the end of our program proper. I just want to say before we move to the open mic part, if there's anybody who wants to hop in the open mic, you can jump in on the Twitter Spaces, and we'll do like a half hour tonight because we're already at the 2-hour mark. But you can hop over to the Twitter Spaces. You can click on the little microphone thing, and if we said something that you don't like, you can raise your hand there. If you said something that you do like, then you can say something. If you're a big fan of the Crystal Light lemon lime flavoring, would love to hear from you. That's not an endorsement. I don't get any money from them. But if there's something else that we didn't necessarily touch on, then you can hop over to the Twitter Space and raise your hand there. I do want to reiterate, just as I vamp for a second, in case anybody does want to raise their hand over there, the last bit where we talked about the correlation between critical thinking ability and intelligence is not meant as a dig. And the last thing that anybody should be doing with anybody who is in good faith trying to understand an issue or engage in a discussion is be like, you don't understand that because you're stupid. That's an incredibly counterproductive and harmful way to engage with somebody who is engaging in good faith. The reality is if you're having a conversation with someone and they are engaging in good faith, pointing out these realities doesn't accomplish anything other than make them feel bad. The other reality is not everybody has had the opportunities to be exposed to the educational systems that allow for the development of those critical thinking skills. So if anybody's listening to this episode and taking the studies that we referred to there, that we had up on the screen as evidence of, conservatives are dumb, that's not what we're going through here at all. There are lots of people who have fiscally conservative bents who are highly, highly intelligent. The point that we're trying to make here tonight is that you can't measure that fiscal conservatism as part of conservatism anymore because it's not part of what motivates them. We can see this through the Turkish Tylenol. We can see this through the many, many ways that Danny has hemorrhaged taxpayer money for no good reason other than her own ego. So fiscal conservatism is not a thing anymore. When we're talking about conservatism, we're talking about social conservatives. And when you take a look at some of the biggest people who are leading the social conservative movement right now, you see nothing but insecurity and unaddressed trauma, and dunking on those people and calling them stupid is no good. Don't attack the person. Attack the point, in all sincerity. Danny makes a lot of bad policy decisions, and she makes a lot of decisions that are going to hurt people. And she says things that do hurt people. But not once on this show, and never will you hear myself or anyone else who's affiliated with the show or doing the socials for the show or anything else like that, you will never hear anyone say, and she's a bad person. Because that's not how you have a conversation with anybody. We don't have anyone in the Twitter Spaces tonight, so I'm going to go ahead and plug the things, and then we're going to wrap it up because it has been a long show. So we have the merches. We do. You can get the mugs, you can get the T-shirts, you can get the hoodies, you can get all of those things at abpoly.ca. I'm told that we get a little bit of money for it. So, and I love the mugs. I love the logo on the mugs. It just makes my heart happy. We do have the T-shirts that play off of the catchphrases that I've developed. So we've got there's a lot to unpack here and to keep the conversation going. And then we also have still the beanies. That have one of the breakdown logos on there. All of this you can get at abpoly.ca, and they're nice. And then if you wear them near any of the political leaders in this province, I imagine that you'll be able to transiently increase their blood pressure by some level. We also still do have our Patreon page at www.patreon.com/thebreakdownab. And I want to take a second to address something here, because there was a concern that was raised that Patreon was supporting the efforts or they were supporting Russia. And we took that seriously because we don't want to support the Russia because they're doing some very horrible things right now in a lot of different ways. We're pretty sure that we're on their bots list based on how many bots we get on a given day on our Twitter page. But what's actually happening with Patreon is they are continuing to support content creators in Russia, but Patreon is actually blocked in Russia. The Russian government has blocked Patreon entirely. So we are comfortable that the Patreon platform is not supporting the Vladimir Putins. And so we're going to continue to use them. If anybody has any evidence to the contrary, please send it our way. But we spent a disproportionate amount of time going through that to make sure that we're not doing a big thing badly. So all of that being said, if you appreciate the kind of content that we're trying to produce here at The Breakdown, you can sign up to be one of our Patreon sponsors at www.patreon.com/thebreakdownab. You can sign up to be a free member. I don't actually know what that gets you other than the updates of we've done a new thing. But it... you can sign up for a small amount and you get access to all of our interviews. And we are, once again, turning on the fire hose with the interviews for the next little bit. We have a conversation coming up with two community groups that are advocating for the rezoning changes here in Calgary, as well as, and it'll remain a mystery for the time being, an Edmonton city councilor who's going to be speaking about the effects of rezoning in Edmonton. And all of this because it's now a provincial thing with the Bill 18 and the Danny and everything. And we were able to record that on the 12th and get that Edmonton City Councilor's response to Bill 18. So it's a spicy little panel episode that'll be going up for our Patreon sponsors sometime tomorrow. And then it will be broadcasting on all of our platforms on Tuesday. We also have, and this one I'm so excited for, we have a conversation with harm reduction advocate, amazing human being, Guy Felicella. And this is a new conversation. I know that we re-upped the old one with him a little while ago. We did that in some preparation for this conversation, because in this conversation with Guy Felicella, we're talking about his whole experience with coming to Calgary and being banned from the recovery conference, just attending. He wasn't even speaking. He was just attending. He was banned from attending the Capital Recovery Conference, or whatever the name was. He was banned from attending that by the organizers because the Recovery Capital Conference. He was banned from organizing that because he went to an event where the keynote speaker is probably one of the preeminent voices in addictions and harm reduction in Alberta, Dr. Esther Tailfeathers, but there were some other people in attendance at that event that the Recovery Capital Conference decided they didn't like. This is now, over the last 24 hours, apparently spiraled into a whole legal thing. It's gaining all kinds of traction. But we talked to Guy about not just what happened there. How did anybody decide that Guy Felicella was a voice that didn't need to be heard? But we also talk about what he did while he was here in Calgary, and some of the folks that he met up with here. So it's a really, I love chatting with Guy so much because he's so authentic, he's so sincere, and he comes from a place where he just legitimately wants to see people not die. So that episode's going to be going up on for our Patreon sponsors on Wednesday, and then we hope to broadcast it on Thursday or Friday. So we've got lots coming, and then we have another 2 booked for next week. So it's going to be a busy little time period. All of which is to say, if you like the early accesses, www.patreon.com/thebreakdownab. I think that's it, folks. I think we're done. In the meantime and in between time, I want to say thanks to a couple people. First of all, thanks to everybody who helped make this tonight's show a reality. We have a lot of folks who are working in the background who prefer to stay anonymous because it's almost as if there's some people who are afraid that the government might be vindictive. Billy Teen Cough. So I want to say thank you to everybody who's working on the show, everybody who's cutting up the snippets for the social media. I personally just appreciate it so much. I want to say thank you to everybody who tuned in tonight, whether you're listening on the Twitter Spaces or you're watching on the YouTubes or the Facebooks or the Instagrams. Apparently, we do that now. Thanks for taking the time on a Sunday to hang out with us for a bit. I want to say huge thanks to the chat. I love seeing how many messages we have on there and the community that's been built in there. I think it's just one of my favorite things to do after a show is to scroll through and to see all of the messages in there. This is not, if A, I don't drink, and B, if I did, it would be out of a 4-liter jug from a store in Edmonton. People in the chat are asking whether or not there's vodka in the bottle. It's not. It's honestly just lemon lime, Crystal Light water. I wouldn't be able to talk for 2 hours if I was drinking vodka. Thanks to everybody who listened on the Twitter Spaces. And again, I really want to highlight there is a stunning amount of bullshit that is being fire hosed out on the province of Alberta by people who should know better, by people who, just by nature of the positions that they hold, should be able to have other people say, yeah, that's not quite what happened. It shouldn't take a small group of people who put on this podcast to, if we can fact check all of this stuff, the Premier of Alberta, with the full resources of a majority government and all of the staff, should be able to fact check this stuff. And the reality is they're not, because they don't want to, because it's politically expedient and it's easier to lie to Albertans. And the only way that we're going to extricate ourselves from that is if we have conversations with more people. And sometimes that's going to mean that we have to bring them along a little bit. And that's okay. Don't have to tolerate the bullshitters. We'd still have Danny on the show, but still haven't gotten a response. But when you're talking with your friends, when you're talking with your neighbors, as long as people are having conversations in good faith, meet them in good faith. because that's all part of making the conversations happen. So all of that being said, I think maybe we'll have another live show next week. It will depend on how tired everyone is after the two other episodes that we're putting out this week. But keep an eye on our socials, keep an eye on our Patreon page, because we'll announce it if it's going to be another 2-week wait. I want to say thank you to everybody. If you're listening to the audio version of the podcast, leave a review. If you're watching on YouTube, maybe smash that subscribe button, like button. Share the episode. Send it to 3 people. Or don't. I'm getting punchy. It's time to wrap things up. Thank you so much, everybody. Stay safe. And as always, keep the conversation going.